Welcome to the module Hepatitis B, What You Need to Know, a Frontline Forces training presented by Superior Health Quality Alliance or Superior Health. This learning module was developed for direct caregivers working in multiple healthcare settings who care for a variety of patients. It may also be helpful for a family member who cares for a loved one in the home. This course will provide a review of hepatitis B and will build upon your current knowledge. Direct caregivers play a current role in providing care to individuals in many settings of care. You may ask why? Because direct caregivers spend a great deal of time with their patients, which helps them to know and understand the needs of these individuals. The purpose of this course is to further your knowledge about hepatitis B and how to use this information. What you know and do can improve the quality and safety of the individuals you care for and keep you and your loved ones safe as well. This learning module, Hepatitis B, What You Need to Know, is part of a series of modules exploring different types of vaccines that are helpful in keeping both caregivers and the patients they care for safe and healthy. You are reviewing the third module of the series. It is not necessary to complete the entire series in one sitting. You can leave and return to any of the modules in the series at any time. Once you have completed this learning module, you may test your knowledge and understanding of the material by completing the quiz. Following this module, the learner will be able to explain what is hepatitis B, recognize the problems that are caused by hepatitis B, describe ways of preventing hepatitis B, discuss the importance of seeking support if they become sick, and where to find help. You may have heard about various types of hepatitis A, B, C, D, and E, all caused by a virus which may cause harm to the liver. However, not all types of hepatitis have a vaccine which will prevent you from getting it. Hepatitis B has a vaccine that can keep you safe. In this module, we will talk about hepatitis B. As mentioned, it is a serious virus that is life-changing and, if not treated, will lead to death. Affects both males and females of all ages. Hepatitis means inflammation of the liver. Let's talk about the liver. If you are interested, watch the video in the resource section titled, What Does Your Liver Do? The video explains the function of the liver. Here are the key facts you need to know about the liver. Weighs about 3 pounds, just under your rib cage on the right side, creates proteins that clog blood to stop bleeding when it starts, cleans the blood to take out toxins and waste that comes in our bodies from what we eat, drink, inhale, and or absorb through our skin. Makes bile that your body uses to digest your food and aids in taking out the toxins. Turns the foods you eat into glucose, which is the body's source of making energy we need to move, think, and breathe. Some people are born with hepatitis B, and some people get it from contact with someone who has it. Not everyone will have the same symptoms. A person with hepatitis B may have one or more of these symptoms. Yellow coloring of the skin and the whites of the eyes, known as jaundice, dark urine, pale colored stools, pain in the area of liver or abdominal pain, joint pain, fever, itching all over the body, nausea and vomiting, loss of appetite, extreme fatigue and weakness. Be aware some people do not have symptoms and will not initially be affected by it, but they can still be a carrier of the illness. Until the liver is sick, you may not know you have hepatitis B. It is important to understand how hepatitis B can spread to protect ourselves and others. The others could be the patients we care for, our family, and/or friends. It is a step in reducing the number of people that get hepatitis B if we all understand this information. Please share the information with others to reduce the number of people that get hepatitis B. Hepatitis B spreads through contact with blood or bodily fluids from a person who has the hepatitis B virus. Examples of bodily fluids are blood, and know that only a tiny amount of blood is enough to carry the infection to another person, and blood can be carried in vaginal fluid, anal fluid, and semen. Another word for semen is sperm. It also can be carried in saliva, also known as phlegm, mucus, or spit. A few common ways contact may happen include: if you are pregnant, your baby can develop hepatitis B from mother to infant during pregnancy. Sharing of blood or bodily fluids, and those fluids get in through an open wound or mucous membrane, such as children playing or non-sexual person-to-person contact. Sexual contact where bodily fluids are shared, including through the mouth, nose, and open sores. Sharing of needles and/or other tools to insert drugs into their bodies. Here are a few ways hepatitis B is not spread. There's not enough blood or bodily fluid shared between people to spread hepatitis B through sharing of food and drinks, hugging and kissing, holding hands, or coughing and sneezing. A mother's milk is considered safe, so breastfeeding is allowed unless the mother has cracked nipples with a lot of bleeding. It is important to tell your doctor if you have or suspect you may have hepatitis B so that they may help you with breastfeeding and care for your baby's safety. Over time, hepatitis has wrongfully been considered an illness that only happens to people with poor habits, unsafe lifestyle, and/or lack of morals. This is not true, but these feelings may cause shame as a result. People may not tell others if they have it. They may not seek treatment. Some people may not know they have hepatitis B, so they can spread it unknowingly. Getting as much information and support you can about your situation can be helpful when explaining it to your doctor and your family and friends. Do not be afraid to ask for help. If left untreated, it doesn't go away. Due to ill side effects, it can cause you to lose work time or completely lose your job, which leads to more problems. If you are someone that others rely on, it is important to be as healthy as possible, as you may also lose the ability to care for your children and other family members. If you do not get treatment as soon as possible, you could have permanent damage to your liver and other bodily functions, as well as a link to cancer. You can die from hepatitis B. In addition to avoiding behaviors that may cause hepatitis B, a vaccine to prevent hepatitis B is available. If part of your work includes exposure to blood and/or bodily fluids, your workplace may offer the hepatitis vaccine for free. You should take advantage of this opportunity. If not, ask your doctor or clinic for information on availability and cost of the hepatitis B vaccination. You may also seek out a free clinic. Talk to a community health worker, case manager, or a social worker. You can find these helpers through the Department of Public Health 211, your clinic's website and resources, or ask someone in your neighborhood if they know these helpers. Contact your local Department of Public Health. Contact a pharmacy. Talk to your employer. They may have a program or resources to share with you because it is important to them that you remain healthy and a safe caregiver. Another important step in prevention is to tell. Tell your family so they can be supportive. Tell your sexual partners so they may be tested for hepatitis B. Stop their sexual encounters with you and others. Tell the people that you share needles with. It is important to know when and who should get the hepatitis B vaccination. Here are some of the situations that indicate you should get the hepatitis B vaccination. Healthcare and public safety personnel with reasonably anticipated risk for exposure to blood or blood-contaminated fluids, residents and staff of facilities for patients with disabilities, sex partners of hepatitis B positive persons, sexually active persons who are not in a long-term mutually monogamous relationships, persons, for example, with more than one sex partner or during the previous 6 months. Persons seeking evaluation or treatment for a sexually transmitted infection. Persons at risk for infection by being exposed in any way to blood. Current or recent injection drug users. Household contacts of people who have hepatitis. International travelers. In addition, the following individuals should also get the hepatitis B vaccine. Persons who need dialysis, persons with diabetes, persons with hepatitis C virus infection, persons with HIV or AIDS, which is the human immunodeficiency virus, persons who are in jail, persons with chronic liver disease. The hepatitis B vaccine requires 3 to 4 injections over 3 months, depending on the manufacturer's dose instructions. A future booster dose may or may not be needed. It may also depend on the health of the person. Check with your doctor or public health department to see what they would recommend. Hepatitis B is diagnosed through a blood test, which means taking a small amount of blood from your vein at a clinic. Once it has been determined you have hepatitis B, your doctor will provide a prescription for medication, which is available in a pill form. Depending on what damage has already occurred, there may be additional treatments and recommendations made by your medical team. As mentioned, take action by getting a vaccination for hepatitis B. If you are concerned you may have hepatitis B, don't wait. Talk with someone you trust. Here you can find the references used in this presentation. Also, you can find a number of resources that you can explore this subject matter further. Congratulations, and thank you for watching. You have successfully completed this module. It is now time to test your knowledge by taking the quiz. Click on the link for the Hepatitis B, What You Need to Know quiz on the Frontline Forces webpage or in the YouTube descriptions below. When you have completed the quiz, you may want to let your supervisor know. This material was prepared by the Superior Health Quality Alliance under contract with Centers for Medicare and Medicaid Services, known as CMS, an agency of the U.S. Department of Health and Human Services.